Mr. Bartholomew Sati, you have been managing the health sector in terms of leadership through the National Association of Nigerian Nurses and Midwives in Kaduna State. How has the health sector been in the last 2 years? Let me make it more specific.
Well, in terms of budgetary allocation, there has been an improvement towards that because with the highest met in 2018, however, in 2019, the figures drop. But it is not all about the budgetary allocation. It is all about release of the funds and backing it up with cash, because that is where the bottom of the line lies. Whatever the figure that was budgeted, if there is no cash backing, it's like nothing was done. So far so good, but with the support of donor agencies, the gaps, some of the gaps that would have been existing, especially in terms of routine immunization, family planning, primary health care under one roof, would have, and then childhood killer diseases would have suffered much setback. However, we still commend the federal government, at least for allocating or for adding the basic healthcare provision fund in among the agencies that benefit from the 1% federal revenue for allocation. We believe that if that is implemented in the 2020 budget, it will equally go a long way to augment the funding of health services in the country, and that will scale up activities. It is likely that more personnel will be recruited, more will be trained, basic equipment supply will improve.
Yeah, look, you are talking about 2020 budget plans, which is still at the medium-term expenditure framework level from the government, though there is an expectation of having the budget within this September. What is the performance of the 2019 budget in terms of implementation in the health sector in particular?
The 2019 implementation, as far as figures that we got at hand, showed that it is only the personnel costs that was 100% implemented, in that I'm not sure if there's any health worker or anybody working within the health sector that is being owed. However, in terms of capital expenditure, as it is now, it remains at 0%, and it is our prayer that the government will look at it so that at least, even if it is not 100%, let there be a significant percent released in order to ensure that supplies are sustained, equipment are bought, those that need repairs can be repaired, and some other things. Otherwise, if the capital budget is not implemented, it's like we are not doing anything in respect of health. We will only be paying salaries without much services being provided.
How do you mean that capital budget 0% cash backing? Is it possible because the government has indicated interest to equip the health sector in terms of equipments, international best standard equipments that will make Nigeria meet up with its peers around the world or in Africa in terms of health delivery? What is the situation like?
Okay, let me simply put it this way. Somebody came to my house and I told him I'm going to buy a bicycle for him within the year. Maybe I told him that in January, and he has waited up to September. There is no single kobo that has been released as a deposit for that bicycle. Not even to talk less of even buying the bicycle. So in essence, what I'm just trying to say, of course, whatever was budgeted are indications that those things will be provided. But physically, in as much as we don't see them on ground, and in as much as findings reveals, there has been no commitment of a kobo based on the allocation in respect of capital budget as far as the 2019 budget is concerned.
What do you think is the problem? Is it to do with the cash backing or the entire budgeting system? Is it only the health sector that is affected? And if it's only the health sector, how has that affected the health delivery system in Nigeria?
Well, in as much as I cannot say why it is so, because it is government that owe the people why they have not released a single kobo in respect of capital expenditure for health. But I want to feel that probably the commitment that we expect from the government that prepared the budget is to indicate to Nigerians that yes, we are committed, we have agreed we are going to do this, even if we have not gotten all that we needed to do. At least there should have been a sign that with the little we have gotten, we have started utilizing it based on that. Certainly there is no way it will not have negative effect on the healthcare delivery system. A situation where you have broken down equipment that needs to be replaced, a situation where you need modern equipment to work with, and a situation where you need to expand the infrastructure, and probably you even need to build more ones, new ones, in order to get health services closer to the people. And while all these things are not done, it now means that the health consumers that are supposed to benefit from the provision of all this infrastructure are the ones that are mostly affected.
And looking at the enabling laws, the health sector has been, more or less empowered based on the legal framework on how to access funds. There's a basic healthcare provision fund. There's also the Abuja Declaration, which requires 15% allocation to the health sector. There's also the 1%, consolidated revenue allocation. And you are still saying that the funding is less than 4%, not even close to the 15% expected by the agreement since 2012. What is the problem?
Well, there's a difference between policy formulation and policy implementation. Of course, by the Abuja Declaration, it was declared that 50% of the entire budget of the country will be allocated to the health sector. That was a formulation. But as far as implementation is concerned, as of now, it's only 4.75%, which has left a gap. And again, as you asked, in respect to the Basic Healthcare Provision Fund, yes, that is a very good idea, and we are grateful and we commend government, as I earlier said, in taking that fund to be among the agencies in the statutory allocation of the federal government revenue, consolidated federal government revenue. So, but again, we want to say that the federal government is not the only body that should implement that basic health care fund, but the states all over the federation are expected to assess that fund by paying the deposit of 100 million naira. As I speak to you now, in respect of my findings, only 22 states have indicated interest. And out of the 22, it is not all of them that have actually shown commitment. But since I live in Kaduna, I know that Kaduna State have paid their 100 million, and they are in the process of trying to see that it is being implemented for the fulfillment of the universal health coverage.
Looking at the health sector, it's on that concurrent list under the Nigerian Constitution 1999 as amended. The states, you are talking about 21 out of 30 states and Abuja that have key into the basic health care provision fund. What do you think is the problem? And the basic requirement of this health sector intervention and delivery system lies with the state and local governments, primary healthcare system, tertiary healthcare system, which are the basic requirements. Other, intervention at the level of, universities, university hospitals is supposed to be under research and critical cases that ought to be taken into. How do you think the basic healthcare system should be addressed?
Well, it all has to do with commitment and prioritization. Though I cannot say that these are the reasons the states that have not indicated interest or have not made any move, but I do believe that probably they have some other priorities where they feel that 100 million naira should be channeled to. But all the same, from at least I was following all the campaign promises, there was none of the governors that never said pronounce healthcare and education as part of their priority.
Why? Why is it so? Is it that the sector has not been able to reach out to the politicians during the campaigns to be able to indicate, alert them on this reality that the health sector is one of the basic requirements, apart from education, possibly with agriculture to feed the population?
Well, the health sector certainly is critical, because a well nation is a wealthy nation. And if we just look at it from this point, as we are in the studio, if one of the equipment falls sick now, the whole thing stops. And in the same manner, whatever sector we are, if for instance, in the school, if the lecturer is sick and he does not come, of course there is a vacuum. And back productivity will certainly be reduced if we don't have a healthy nation. And that is why we feel that those that identify health as one of the basic priority of their programs are not out of order. But all the same, I am not saying that other sectors are not vital. In essence, to round it up, I think every sector needs the other, because once the whole sectors synergize to work together, the country will progress. If the farmer farms, and we have enough food, we are already talking about availability of food. We are already talking about good nutrition, which is a key for the body to build its immune system. If the people are educated, of course, they will know some of the behaviors and actions that could either lead to disease or that could either prevent diseases. And by so doing, we would have reduced the number of people that fall sick and go to the hospital for care.
Lead me into it. Looking at this financing, capital budget, 0% allocation in 2019, how does that affect the health delivery system in Nigeria? People are concerned that if you go to hospital, you are expected to run a test or pass through certain, surgery, operation, or something like that. Even as a patient, you find difficult to understand where is the funding going to. What is actually the problem? Is it the financing or the implementation of the budgeting system?
Well, first and foremost, we need to ask. If we are asking where the funding is going to, we need to ask, was there funding or an allocation? As it is now, based on findings in 2019, the funding is not there, but there is an allocation. Because sometimes you hear that federal government, federal executive council, or state executive council have approved this amount. But you discover that throughout the year, the project that amount is aimed at financing does not take place. And by the time you find out, they will say, yes, it was approved, but they are still waiting for the release. And after the release, they will still be waiting for financial backup, which at the end of the day does not come. So I think the issue is, if the money is released, and we know it is released, and the equipment are not, or the capital expenditure is not financed, they will now ask, where did it stop? Did it actually get to the execution point, or is still hanging elsewhere? But in this case now, it is not yet funded. Yes, it is up. There is an allocation for it.
If you are just joining us, the program is in the news. You are reaching us from Voice of Nigeria in Abuja. You can join us through www.von.gov.ng. I understand that our Facebook Live is going, and Ekene, Onumonu, and Gloria Essien are following us. Many others can join us through the Facebook. Our address is vonnewscast.9. You can join us through www.von.gov.ng. We are discussing the health sector, how best to improve the health delivery system in Nigeria through funding. There's the challenge of funding, especially the capital segment of the budgeting system in Nigeria. The Budget Act is being enforced. The 2019 budget is on almost in the third quarter of the year. But the concern of the health sector is that there is zero funding of the capital budget, the component that is supposed to provide equipments for the health sector delivery system to be achieved, in line with the universal health coverage, target by the United Nations, General Assembly or United Nations system. I'm talking with Mr. Bartholomew Sati, Chairman, National Association of Nigerian Nurses and Midwives, Kaduna State Chapter, as well as PACFaH, that is a Scale Project Director in Kaduna State. That's Partnership for Advocacy in Child and Family Health and at Scale. It's a platform under which health system advocacy is being carried out to improve health delivery system in Kaduna State in particular, in Nigeria in general.